Good morning. Today I'm going to talk about Urticaria. This is one of the series of lectures that you have been assigned to. 3 lectures are to be given. One is Urticaria, acne, and the drug reactions. So first I'll start with Urticaria. Urticaria is characterized by the formation of wheals, which leads to swelling of the skin that disappears, leaving no visible sign. There is dermal edema due to vascular dilatation in response to histamine released from mast cells, which causes skin itches or stings, wheals, develop, and it appears at many sites at once. It always clears spontaneously within few hours, usually less than 24 hours, and new lesions may continue to develop. In angioedema, edema extends into the deep subcutaneous tissue, especially around eyes, lips, mouth, and pharynx, and can lead to complete closure of the eyes with swelling of the lips and tongue, which can compromise the airway. Urticaria and angioedema may form part of a systemic anaphylactic reaction. Urticaria we usually divide broadly into two groups. One is acute urticaria. The other one is chronic urticaria. How do you define acute urticaria? If the attacks last few hours or days, usually less than 6 weeks of duration. Usually it has a cause, and its causes are either contact with plant nettles, animal fur, dog, cat, an ingestion of foods, nuts, maybe shellfish, strawberries, or ingestion of drugs, especially aspirin, non-steroidal anti-inflammatory drugs, penicillin group of antibiotics. So in acute urticaria, you have to most of the time you have to find a cause, whether it's a sort of contact with food, drugs, or preceded by an infection. In atopic people, they are more susceptible. Why you get acute urticaria? It's a reaction triggered by the IgE antibodies, and some reactions are due to direct mast cell degranulation, especially in case of aspirin ingestion. There is a sort of picture showing acute urticaria with wheals, which causes erythematous, swollen, discrete lesions, can occur in anywhere of your body. Now I'm going to chronic urticaria. Here the attacks last more than 6 weeks duration and maybe months or years. Here the single causative factor is rarely found. But again, the acute urticaria may progress to chronic urticaria after the duration of 6 weeks. In most patients, chronic urticaria is due to an autoimmune process or to one of the physical stimuli. Here again, chronic ingestion of food preservatives, food coloring may be occasionally an important cause. In physical urticarias, you can elicit sign called dermographism, where you stroke the skin, which leads to appearance of wheal after scratch. Delayed pressure urticaria, where wheals develop up to 24 hours after the pressure is applied. Another form of chronic physical urticaria is cholinergic urticaria, which affects young men, where sweating is accompanied by small white wheals with a red halo on the upper trunk. Another cause is cold and heat, which can precipitate urticaria. And water or the aquagenic urticaria, where we come in contact with water, it precipitates urticaria. Or sometimes when you're exposed to the sun, these two can precipitate solar urticaria. This is a picture showing dermographism. Where you stroke the skin, you can induce erythematous weed. There's a few words about hereditary angioedema because it's an autosomal dominant disease, very rare, where it's due to C1 esterase inhibitor, either it's defective or lacking. It causes sudden attacks of angioedema, which can be life-threatening. And it causes spasms of abdominal pain due to gut involvement. It doesn't respond to usual antihistamines or steroids. The treatment is the danazol, which increases the enzyme level of C1 esterase inhibitor. Acute attacks, you have to give purified enzyme preparations. We'll talk about management of urticaria in general. If possible, the trigger has to be identified and should be avoided. It could be, as I said, it could be a drug. It could be a passing by infection, either viral, bacterial, or it could be a food factor. Aspirin and aspirin-like substances should be avoided by anyone prone to urticaria. Most types of urticaria respond to H1 receptor antihistamines like desloratadine or loratadine, levocetirizine, cetirizine, or fexofenadine. H2 receptor antagonists too, like cimetidine, ranitidine, may be added if the other three drugs, like H1 receptor antagonist, doesn't give an adequate response.